We talked about all these various subtypes of cancer, but when patients first come in, what kind of questions do they usually have for you? I mean, they've seen me and they're like, you know, a lot of times they don't want to ask me certain things, which is kind of weird, but it's kind of natural. But what do they ask you?
Patients do open up to nurses, maybe a little
I know they do.
more.
Well, I like that. That's the point.
We see the spectrum of emotions to the very stoic, like I'm going to fight this, and then we have the patients who have tremendous concerns about their future, and we just try to comfort them and let them know that once we know what type of cancer we're fighting, the type of breast cancer that we're fighting, that we have the means to treat it, and we're going to be with them every step of the way.
That's good, but the question really is, I mean, are there any questions in common that people tend to have? Like, you know, is there anything you always get? Like a question about breast cancer, is there something always people get?
I would say some of the most common questions, of course, are side effects, because everybody seems to know somebody who's been treated for cancer, and whether it's the same type of cancer or other cancers. Am I going to get sick? Am I going to lose my hair? Probably the most common questions the nurses have are what type of side effects am I going to have, and how do we deal with them?
And which ones in particular? I know people always are worried about nausea. You know, they saw that movie. I forgot the name of the movie. You know, the kid who had CML. You know, God, it was a long time ago. Well, we both kind of, although you're much younger than me, right. We both know there was that movie. I forgot what it was. Someone had CML and he got really sick and he lost all his hair and he was throwing up all the time. And I just remember people always asking, am I going to be nauseous? Am I going to throw up? Is that really a big one now anymore?
That is a very big question, because most people have maybe people in their family that were treated 20 years ago for cancer. And I always tell them we've come a long way with anti-nausea therapy. And as a matter of fact, our most common complaint from patients is probably fatigue as opposed to nausea.
Yeah, the fatigue is a big one. And what do we do about that when people get it?
With fatigue?
Yeah.
Well, we advise patients to rest when they need to, and if they feel energetic, to take advantage of that and get out and do things that they enjoy. But for the most part, just kind of listen to their body.
And the other one I get especially with women, is hair loss. I mean, a lot of women will go, look, you know, I'm going to lose my hair. Okay, it's better. I want to live, you know. But some people are really dead set against losing their hair. I mean, and I see part of it, but again, I'm a guy, I'm a doc. You know, you're a nurse, you're a woman. You probably hear more of it.
We do hear a lot of concerns about that, and again, that sometimes guides your treatment options as to what they're going to get. We try to offer emotional support. We give them resources. The American Cancer Society. We direct them to places that they can purchase, you know, head coverings, wigs. But we listen to their concerns, and we try to.
Do they ever ask about the cold caps?
We don't have many conversations about the cold caps, but we try to give them as most information that we have. But unfortunately, we don't see that a lot.
And you probably remember this. I mean, to some degree, we really went through a period. We almost bought the machine. There's a machine now. Remember this whole thing that happened a couple months ago, about a year ago, you know, where there's a machine that circulates. Kind of like a refrigerant over your head, and so people don't lose their hair. But it was at the time, it's still very expensive. We weren't sure it was covered by insurance, and we decided not to do it. But a lot of my colleagues around the country, especially at UCSF and other places, really wanted to use it, and it's very successful. And I'm surprised people haven't talked as much to you guys about it.
We do let them know the pros and cons of that, that it is a big commitment on their part.
It's a huge commitment, and you tell them that's like an hour or two in the chair before,
it's a big commitment.
After, it's a big deal.
And we do provide them with the necessary resources to look into if they do want to follow through on that.
Good. So the other thing to talk about is that, you know, one thing that's always important, is you kind of hinted at that a little bit, is why is it important to have a treatment plan for people? You know, to have a plan for them up front.
Oh, it's absolutely important to know, for everybody involved, to know what the plan is, so that we're all on the same page. And if it's based on their specific pathology, so we're all on the same page.
Right. And so what we do with people, as you know, is that the way it works in our practice is that I'll go in and see patients, and I'll talk about everything in general, you know, especially if they need chemotherapy as part of their plan, and then I'll have you guys come in and then to do what we call a teaching session to everybody. Can you explain what that is, what you guys do during that session? When
you determine what the treatment plan is going to be, we gather the materials and we go in with the patient and we'll go over the different drugs that you've chosen. We'll go through the most common side effects, talk about lesser common side effects, how to treat those side effects at home and when to call. We also talk about when they absolutely must call us right away if there's a fever that they develop. In any life-threatening situation, we would want them to, of course, seek emergency assistance. We also provide them resources, not only for their medical side effects, but perhaps social work or a dietitian. So we talk about all of the available resources available.
How many people do you think look for a dietitian? I'm really curious.
There are many patients who want to be proactive, and that's something that they can do on their own as far as nutrition therapy. And they're actually, many patients are very pleasantly surprised that we have a nutritionist on staff. You know, many people want to know, they've heard if I don't eat sugar, is that going to help? Should I avoid red meats?
Or chicken even.
Yeah, so we have a lot of patients who, again, that's something they can do on their own that they're very interested in knowing more about.